Well, hello, this is Paul Feuerstein, editor-in-chief of Dentistry Today, and I'm here with a good friend, Brent Herman. Brent, how are you this morning?
I'm good. Good to see you, Paul.
And Brent is the founder and CEO of MouthWatch Corporation. And during the COVID shutdown, at least at my Massachusetts, I know many of us sat around staring at our computer screens, looking for information, trying to get CE classes. And once a day or once every other day, Brent Herman's face would pop up because he was the man. And we'll tell you why he was the man. And I personally depended on Brent for information about how do we get in touch with people, patients, et cetera, while this is all shut down, because people were asking me the questions, and I'm expert enough to know who to ask, and Brent is my go-to person, to be honest with you. So there's this buzzword around called telehealth, and it's been around for a very long time. And then Brent, you took it and zoomed it in and called it teledentistry and formed a company called Teledent. But you did it way before COVID, didn't you? When did you start this whole thing, and what was your vision there?
Yeah, our original approach was really about connecting patients to their dentists. So we wanted to engage the patient at home if they had more of a chronic condition that required dental care or post-operative care. And it really evolved over time through provider to provider, innovative hygiene models, outreach into the community. And then the pandemic really put the spotlight on patient and provider communication again about how a practice could engage their patients. And really it's, grown from there to become a part of day-to-day practice and really giving patients the convenience they want. And I think the efficiency practices crave.
Well, my son worked in a hospital in Pittsburgh, and he was doing a lot of clerical work. And the next thing you know, he's scheduling telehealth visits, and it became a huge thing. Actually, it became an actual frontline process to see your patients over the internet. And it was a billable service too, which was kind of interesting. And you also were very, very helpful in setting up that whole foundation for all of us. I want to thank you for starters on that vision. But more than seeing engagement with patients, you also allow us to engage with other practitioners and do it through this big fat word called HIPAA. And I mean, it's very typical for me to send an email to someone and say, "Hey, Jim has an impacted third molar. Here's an X-ray." But actually, I mean, that's not quite the way it's supposed to be done, is it?
Well, it's one way, and it's definitely been done that way. I think we can make for a much more effective consultation. And I think the way people communicate face-to-face, even if it's virtually face-to-face, brings a lot more to, I think, the experience. I think so many people are working remotely. So many people, when it's not clinical across business, across school, there's so many places where that's working and it's shown to be effective. So I think it's a great way for collaborating with your peers, getting expert opinions, and even kind of shepherding patients through the relationships you have with specialists that they've never had, right? So they can kind of feel your trust with that referral and make that a better process.
And then what we found was, and I personally and many of my colleagues found, that patients had issues and we couldn't get into the office, couldn't treat them. So they'd say, take a selfie, or we'd get on like a FaceTime thing or something like that. And again, by the rules, that's really not HIPAA compliant. And what you're providing is a HIPAA compliant platform for this to be proper and make it easier to navigate too. So talk about that just a little bit, about virtual appointments and things like that.
Yeah, so I think it depends on the practice and how they're using it, but we do want to make sure it's protected and it's secure for, both the provider and for the patient. And I think when a patient sees that it's happening through a platform designed for it, that reassures them of that security and elevates I think the appreciation of the provider taking that care with patient data, which is pretty key. But I see the manner in which it happens is really tailored to dental. So I think as practices opened up, a lot of doctors didn't want to spend 15-minute consults in front of a video conference because dentists are paid differently than doctors. So in telehealth, they're paid by time, right? For a medical consult. In dentists, it's by a procedure. So if I'm going to do an evaluation and I can do it asynchronously, so when it's not on video, it's just reviewing data, that's a great way for me to do it. And I can bill in a lot of places the same amount and get reimbursed the same amount. So as my practice started getting busier again and I was seeing patients chairside, then I could do some of my appointments that way, and I could shift other types of appointments to, a virtual video consult too.
Yeah, so even though COVID has sort of dropped a little bit anyway, I don't know where it is right now. this is still a valid process. I mean, for myself, I've had many times now where I've gone and a patient would call with some crazy emergency. I've fractured the half of my front tooth off. And instead of them coming to the office so I can say there's a chip over here, I can just file it down. We could do this through a virtual consult, billable or not billable. It's just that chair time to get there's no such thing as a 5-minute visit these days. You have to clean the room, get the room set up. I mean, everything's a half an hour no matter what. So if I can do this in 10 minutes or 5 minutes on a video or through the portal, I mean, that's unbelievable. And then I'm also seeing certain consultations being done remotely that if you just have to sit down, you've gone through all the registration and gone through all the mechanics, and then you want to just tell the patient, well, you needed this, you needed that. We can do it this way, even late in the day or in the middle of the day or lunchtime, whatever it is, save everybody a trip to the office with gas prices right now, a big deal. So I think this is a great platform. So explain a little bit more about the platform itself, and then I want to talk to you about some of your experiences with some of the dental offices that you've worked with.
You bet. So the platform is cloud-based. It's mobile friendly. We make it really easy across all types of devices to communicate directly with your provider, with someone from your provider's team. You can have multiple conversations. So you could have a 3-way conversation with maybe that specialist, the doctor, and the patient. If a practice wants to accept new patients or get new inbound, they can put a form on their website that allows a patient to initiate a consult, right? Then they could snap some photos with their phone or record videos, submit that. And what we do is beyond just providing the video conferencing or the messaging is really a lot of the workflow around those teledentistry consultations and virtual appointments. So we make sure there's task management, there's scheduling of that. We've got more and more integrations now. So Open Dental, Dentrix, G6, G7, we've got all of these ways so that practices can really bring it into their workflow and have that foundation of telehealth for dental, but then also open up these new opportunities for them for different types of appointments taking place virtually, post-op appointments, shifting initial consults, saving travel time, saving staff resources, right? If you could have someone working from home one day a week as a clinician, providing some of these case consultations and evaluations, everyone wins. Patients win, your practice wins. You've got loyal staff who are happy to, have a little more balance.
One of the features is that this information that's being taken care of through this cloud-based system is chartable. I mean, you can't, if you have a little Zoom conference with a patient, how do you take that information and stick it in the patient's chart? It can't be done. Yep. I mean, it probably can, but this is automatic.
Right.
So I've been told that you've been working with some small offices, some larger offices of DSOs, and they've actually encompassed this whole thing and gotten some fantastic numbers with the patient encounters. So you can mention names if you want to, but you don't have to.
Okay. Yeah, I mean, we've seen some large groups roll it out where it becomes a part of their essential workflow. So both on inbound requests, so if it's an emergency consultation and they're trying to triage it. So Advantage Dental is one of the big groups that's implemented it in the Pacific Northwest, and then they've got offices around the country as well. They've been able to shift. They set a goal of 5%. They hit 7% of their appointments were able to shift to virtual. So that's been really well received. Patients give it a 94% satisfaction rating. The clinicians that are using it really appreciate the time. So they've been able to, work it into their scheduling and workflows to be able to say, look, we can set a time for your virtual consult, or if it's urgent, we can talk to you right now, figure out, do you need that visit? They've got some good numbers coming out of there. So let's say out of 10 people that are calling with an emergency, 3 of them don't actually have to come in. There's something that can be done virtually to save them time. So all this, I think, increases patient satisfaction. But really that bottom line for practices too is I'm delivering the care that's important to our practice, but I'm doing it in a way that's saving me that time and money and resource that I don't have to put into an operatory or, shift into a physical appointment.
Do you have a sense of the patient reactions to this?
Yeah, so it's funny because the patient reactions are really outstanding. They're in 90+% satisfaction and willingness to do it again for a follow-up appointment. sometimes what they found is they didn't even realize that this was part of an appointment, right? That they were having this encounter
Just a little
because
catch like we are right now.
right, they just realized like, oh, they didn't see that it was kind of setting them up for a better and more successful, productive appointment when they came in. So it was great to see that. And then just across different practice sizes. So whether we see an ortho group that's smaller, or we see community programs or public health, FQHCs, all of these different settings are really finding ways. We're seeing more and more on the medical connection. So by putting a mouthwatch intraoral camera with teledent in one kind of site, like a nursing home or a school, right, that's a really affordable way to get medical integration over to a dental. So even if that's just a referral, programs that are embracing that are really seeing significant growth and increase in connections and access and new patients.
I mean, that, and you just touched on something I was going to ask you about. As a practice builder, one of the untapped places are things like emergency rooms, healthcare centers. People come, and we all know this, all as dentists, people show up in the emergency room with an abscessed tooth or some problem. They have no idea. They say, here, take this antibiotic. And if you had a mouthwatch camera, we'll talk about it in a split second, set up somewhere, just say, hey, I'm going to drop something off in your place, and set up a little system. If you have a dental emergency, we'd be glad to take a quick look at it virtually. That's a practice builder. I mean, go into senior centers. I mean, it's just unbelievable that if you put your thinking cap on, it's really can be a wonderful practice builder. So tell me a little bit that this camera. I mean, I shouldn't tell you, I know about it, but tell everybody else about your camera, which has been, I would have to say, it has to be one of the most successful products I've ever worked with.
I appreciate that. Yeah, I mean, our original mouthwatch intraoral camera has done really well. We're in probably over 35,000 practices right now. And it's just really affordable, reliable, easy to use, great images, integrates with everything. The list goes on and on. So we're really thrilled with that. And we've been able to actually start seeing more of that expansion, really because of that affordable price point of under $300 a camera, to get it into settings that would normally not get one. So that might be a school nurse's office or a nursing home or a pediatrician's office. So that's been really growing. And then we recently launched the MouthWatch Plus camera. So we had a lot of dentists asking us, I need a 1080p. I need the biggest, best technology. I'm talking to the right guy for that. So we really took a lot of the essentials that people loved about our camera, wanted to keep that kind of MouthWatch brand price point. So we kept it really affordable compared to a lot of the other 1080p cameras out there. And launched that. We had a little bit of a delay due to some supply chain issues, which I think the entire world has had. But those are shipping shortly, and that'll be great. It's 1080p, full HD imaging, adjustable brightness. So we're really seeing good support and feedback from the practices that have been using it so far.
But as a user, I would just have to say it's a no-brainer. It's plug and play is the understatement of this camera. There's nothing, you just plug it in and start taking it. It's just great. I'm sorry.
I appreciate that.
So what do you see the crystal ball of telemedicine, teledentistry, and we're not out of the woods yet, but we're pretty much out of the woods. I think everybody's back to practice the way they want to be. But how can we capture this and use this in the practices now? And where do you see it going beyond? I mean, what's your vision?
Yeah, so we're working on some really cool ways to expand what teledentistry can do. I think that it's becoming less of this discrete act of teledentistry, so to speak. I think it's more about, and we've talked about this for a while, this is just a digital communication tool that's going to exist between patients and practices. It's going to expand the footprint, I think, of dental into more and more settings where it's not limited by brick and mortar. I think you're seeing practice acts. Now they're talking about multi-state compacts for hygiene. Like, you're going to have a broader reach of programs that can funnel into dental and get more patients into dental offices and more conveniently for patients. So I think when you reduce that barrier, right, of travel, of anxiety, of cost, and open a door to a practice that's not a physical door, you expand access and reach for more practices, increase the number of patients coming in, can serve them more effectively and efficiently. So we really see that. I think medical and dental is really starting to come together. I think technology becomes a big glue behind that. I think there's been a lot of education, and the research and clinical studies have shown the link of systemic health and oral health. That's beyond reproach now. So now it's about the tools and the systems that can really help connect, siloed medical from siloed dental and bring that all together.
So you must be proud of all this.
Yeah.
I mean, really, this is you've captured this piece that no one ever thought about and really come to the forefront, and hopefully it'll be a common tool for everybody. I think.
Yeah, I really appreciate that. I mean, it's come a long way. We've just celebrated our 10th anniversary as a company. You met us in our first year, and I'm really thankful for the team that we've built and the relationships that we have, and kind of what people come to know MouthWatch for. So when it was the pandemic and we could be a resource, if you're using Teledent or using FaceTime or Zoom, we still want to be a resource to help you understand how best to do it. But we love this. We're really passionate about getting more patients into a dental office and getting the care that they need. And I think beyond that is really this things that drives us now is really about really touching more and more, touch points to connect patients, bring them in, address all levels from kids to seniors and beyond, to get them into dental care and do it in a way that's really super effective and convenient for them.
So how do our viewers find out more about MouthWatch and all the processes, products, and everything else? I think it's a simple answer.
Yeah. So we have a website. So go to mouthwatch.com. You can find out about Teledent and both of our intraoral cameras there. We're rolling out some new products and services soon. So stay tuned there and sign up for our newsletter and you'll get some more information, but come on by.
Right. First of all, I just want to thank you again for helping us out through these last couple of years in the profession and me personally. And I wish you the best of luck with what's going on and keep your vision going. I want to see how far you can push this. So it's been great talking with you. And I think that's kind of a wrap. So Grant, thanks a lot. And I'll see you shortly soon at some meeting somewhere.
Sounds good. All right. Thanks so much, Paul.
All right. Take care.
Bye.